Hey everybody. Following back up on my ulnar nerve transposition, today marks about 4 days shy of an entire month after surgery, and just wanted to follow up and give everybody kind of an idea where I'm at, how much farther I have to go, and what you can expect during those first couple weeks after surgery. And to give you a little update, start out. I started physical therapy, slight range of motion. Usually start this at about 3 weeks, give or so. Um, Usually after you get the cast off, depending on which surgical procedure you have, whether it's a simple decompression, which normally starts range of motion after a couple of days, versus a complete transposition, which requires sewing back of your pronator muscle. Uh, if it's submuscular versus a transmuscular or a subcutaneous, where flaps are created and your nerve is placed underneath. As you can see, my incision is covered right now. It might be a little bit hard to see with what you may notice is some gel. This is a sheet or actual piece of gel that's called Circa gel. You can purchase it online, and they typically come in sheets. A little bit larger than this, but however, mine's been cut up from a few previous surgeries for some scars that I have used this with. They are something that you want to use. The Circa gel is something you want to use only once your doctor actually says your scar is ready to have this stuff placed on it. It's usually once scabs have disappeared, the incision's completely healed, and your stitches have been removed. And as you can see, my scar is fairly red still, which is typical after surgery for quite a while actually. Sometimes it could take anywhere from up to 6 months to a year before a scar actually can flatten out, or color change occurs with your scar. And also just depends on your body type. Some people genetically have red scars, or they keloid. I also use this arm sleeve, which is typically something you just buy online. You can probably get it at Dick's Sporting Goods, Amazon, pretty cheap. Got it from China. It's probably like $6. Um, so I just started wearing this right at about 3 weeks, which would have been yesterday. My doctor recommended about a month, or once the scar, all the stitches in the scar was completely healed. So this is going to help the scar heal from the inside out versus the outside in, which is what the actual gel does. Is it suppresses air from getting to the scar. A lot of people have the tendency to keloid, and this helps a lot. I can show you from a previous surgery that this scar was actually very keloided, and it required multiple injections to actually flatten it out for my plastic surgeon. So the better maintenance of scar adhesions after surgery is one of the biggest things that you have to be very aware of, especially with the nerve transposition, because you can get adhesions that will continue to cause nerve problems down the road. So constant movement in your arm once you are signed off by your doctor is imperative. As you can see last time, I couldn't bend completely out. Now I can. It's a little tender right in here, and I can flex past 90, and it feels pretty good. Fingers aren't going off. Forearm right here, where the pronator muscle was cut into a Z pattern and sewn back, is starting to get some of the muscle back, and it is a little sore and tender right here. Numbness, which is something that you have to be aware of after surgery, does happen. Sometimes it may not go away, sometimes it does. A lot of it depends on the time. I, however, have a little bit of numbness all right here. It's pretty dull. It doesn't really bother me, but hopefully it will come back, because I have to have the same procedure done on the right side. So I'm 3 weeks, silicone gel, Circa gel. It's not cheap, might be $50 for a sheet, but it's well worth it. And physical therapy was signed off, so I've started simple range of motions, which is good. The first 3 weeks has been a circus in terms of ups and downs, not sleeping, being medicated. As everybody knows, it will do a toll on you mentally. A lot of people have a lot of problems with anxiety and depression afterwards because you can't do the things that you were normally doing before, and being laid up just, yeah, the propensity to pick up some weight. I'm not gonna lie, I probably put on 2 or 3, 4 pounds being laid up, which is not really disconcerting. I'll drop it in a couple weeks. So don't be afraid. Don't let that stop you from getting the surgery. That's just a backdraw from laying around watching too much Netflix and Hulu and chilling. So that's where I'm at. I have my follow up with my doctor on the 29th. So hopefully I will be signed off to lift more than 5 pounds. Yes, I said 5 pounds. 5 pounds is the weight requirement that you get for the first month. You have to be very careful. Wearing a sling keeps you subconsciously from picking up stuff that is heavier than that. You do not want to tear the incisions that are inside holding your pronator muscle together while they're healing. You can have continuous inflammation from 2 to 3 months after having this surgery, so you have to be very careful. I haven't got any comments or concerns, but I do keep up on a forum on Facebook where people typically ask me for opinions or give them feedback as to what's going on. I just had somebody recently who said they had both of their elbows done bilaterally at the same time. Don't do it. I understand that it's a 2-for-1 deal in terms of your insurance, but the living nightmare that you're going to go through in terms of getting both surgeries at the same time doesn't benefit you. It's just going to make it's going to make things way worse for you. And you don't want to have 2 surgeries and both of them fail without knowing whether or not one would have worked if you would have just done one at a time. Somebody in the UK has asked a question about that the other day and had both of them done and was fairly concerned about it. In the US, I would say our ethics or morals in terms of the doctor realm is on the caution of error. Do one before the other to see what the benefits are before putting yourself through that, or not, or what we consider a non-surgical option. I've seen a lot of YouTube videos on here preaching the choir about conservative measures. In my opinion, they're bullshit. Plain and simple. If you have adhesions, fascial tissue, there's no amount of nerve glides that are going to help you from breaking that up. Sorry. But this shit is genetic. It's not simply sitting at a desk in a bad postural position all day. Is that a part of it? Yeah, I'm sure to some degree, but it's biomechanically and genetically a combination issue in terms of what happens with your nerves. Ulnar nerve compression is the second most prominent nerve compression in your body, first being carpal tunnel. So usually if you have it on one hand, you're going to have it bilaterally in the other. So don't go out there and try to get both of these done at the same time. I'm pretty ballsy in the terms of trying to do something like that, but in reality, you need to take a gut check and figure that one out and then make a decision. But don't do it. Do one at a time. So that was a comment that I had to put my 2 cents in recently. And I've seen a lot of these videos on here from people preaching to the recovery time of what it takes in terms of having this surgery. And I can tell you right now, the recovery time on this is not 3 to 4 months. Post-op pain from this surgery might be 3 to 4 months, but the actual nerve regeneration recovery from this could be anywhere from a year to 2 years, or in some people's instances, never. It all depends on the damage of nerve of your axon, which is the sheath that runs around your nerve, how badly damaged it is. And even if it is repairable, because it is considered a peripheral nerve and they do repair, you're looking at 1 millimeter a day from your elbow down. So figure your mathematics, measure it, calculate it, add that up, and that's a baseline. Then, however much time that takes for that to heal, give it a little bit longer considering the length of time that you were dealing with it. So if you've been dealing with it for a year and the nerve looked good and it takes up to a year, figure it another year. That's where people get the 2 years. So this recovery, it's opinion based in terms of how you recover, because everybody is different. But a lot of these people trying to, sell you on the idea that it's a cut, move, wham, bam, get back to doing what you're doing. It doesn't work that way. And it's usually the people who have no idea what the hell they're talking about, or who have had the surgery and just healed 10 times quicker than somebody else. Everybody's different. But in my experience, because I've gone through it, and not only just this surgery, but multiple other surgeries, you have to pray for the best, or I'm sorry, hope for the best, and prepare for the worst. And that's typically what I've done. So in my terms, I won't be getting back into the gym probably for another month and a half. So I'm looking at least 12 and a half to 15 weeks. I want to make sure that the pronator muscle is healed, everything inside internally is good, and then I'm ready to get back to doing what I'm doing. So as much as I can tell right now, this is good. The pins and needles aren't really happening in my arm. I really don't have a lot of extension backwards with the wrist, so I'm still feels a little funny in terms of pulling in the forearm muscle. So that's kind of where that stands. Length of time, recovery, Circa Gel, which you can get online anywhere. I'm not throwing that out there trying to market or PR for Circa Gel by any means. So I'm here just giving you opinions and kind of what I've been using to go through this. I was told from my post-op that my nerve was subluxing slightly, which was actually from having a simple decompression, which I had a year ago. And the nerve at that time was subluxing, but not completely over the medial epicondyle, which I did ask for my medical surgical notes from the operation. So yes, my doctor did not do the correct procedure the first time, hence why I had the surgery with my original surgeon. So I was a little displeased with that. And from my surgeon's notes and from the discussion we had at length, I had a compression farther up here, which is usually the arcade struthers or a piece of septum. A lot of times people will have extra muscle in their tricep, will cause this as well. So that was one compression point. Some scarring that adhered in here, which, like I said, is imperative that you keep your arm moving and eating healthy and staying active afterwards and keeping those nerve glides. Nerve glides are good only post-op, not pre-op. It doesn't do anything. Think about it. You're just stretching the nerve continuously. You might be able to break up some fascial tissue, but the likelihood of it's probably slim to none. You're probably going to have PT therapists tell you that, occupational therapists. I'm not even sure doctors would even tell you it would be worth doing it. They're basically just going to keep you from bending your elbows for extended period of times, which requires splints at night. So my nerve was subluxing, like I said. Compression point here. Nerve was popping over the bone right here. So in terms of why I had to have it moved was because of that. The nerve kept getting irritated every time I was bending my elbows, and that's what replicated the pins and needles in the fingers and the pain in the forearm. So that's kind of gone now, which is awesome. And so hopefully I'll have a nerve conduction test within the next probably 6 months, and we'll see how fast the nerve jumps from here all the way down, as I had about a 15 gap between top and bottom, below and above. This was about 75 here, and this was about 45 here. So that's a significant decrease between above and below. So hopefully that kicks back up. And like my doctor said, the nerve was definitely irritated, and he said that this should solve the problem, and I should be good to go. In my experience, find the best hand surgeon out there, microvascular hand surgeon. Don't go to an orthopedic who's just got a slight, background. Don't go to an orthopedic who is just a shoulder doctor who does hands You want to see a person who is a plastic surgeon, a microvascular hand surgeon who deals with soft tissues, nerve innervation, blood vessels, veins, blood flow. These are the people that you get the best results from. I can't stress it enough because I've seen some doctors in the past and have had a couple surgeries with shoulder doctors who, if I had really paid attention and known what I was doing at the time, I would have saw the best shoulder doctor in the country to get something like this fixed. And I needed to make a correction. My Dr. Dune is spelled Deune, and he's at Johns Hopkins. I misspelled his last name in a previous video, so hopefully he forgives me. If you got this far through this video, I appreciate you watching it. Please comment. Please, if you want to talk smack or say I don't know what I'm talking about, that's fine. I don't care for all you haters out there. I'm just trying to give the people out there a little bit of insight and comfort, what they can look forward to in having this surgery. And hopefully after my follow-up, I keep you in the loop. And if you have comments, like I said, respond. I usually put this video on Facebook and link it to YouTube so the people on my forum can keep up and ask questions. And for anybody who's still having problems with your hands after the surgery, don't get down. Keep your head up. It's it's a crapshoot. Life's not perfect, and neither is surgery. That's why they call it practicing medicine. They're actually practicing medicine. There is no 100% proof when it comes to any surgery. And if you have any questions, concerns, complaints, feel free to drop me a line. Appreciate it. Take care. Go O's.